I think we should go in na lab. 10:01 na din.
Yeah. Are we live?
Yes. We're live.
We're live. Okay. A blessed Tuesday to all our viewers from different parts of the world. We are the naturopaths in Manila. We are so grateful to be with you today and to share our topic, acupuncture with Doc MacGerald Cueto. Thank you guys for tuning in today with us. Lab, Judith?
Hi, good morning everyone to all our viewers. Thank you for tuning in today. To all our viewers from different part of the world, good morning, good afternoon, and good evening. Thank you so much for continuously tuning in with us. Today, we're going to have a very fruitful discussion with our one of our mentors in Philippine Institute of Naturopathic Sciences. Um, I'm going to introduce him to all of you, but I just wanted to tell everyone that today, Doc MacGerald Cueto will not be with us because he is called to have duty. He's on duty today, right, Pink?
Yeah,
Last
he's on
Sunday,
duty
he
today.
already informed us after our teaser, our peak preview, that he has a sudden change of his schedule that he needed to attend for today, this morning. But
Mhm.
with the goodness of his heart, he still attended to us. He still gave his time. So we naturopaths in Manila gave some questions to Doc Macweto during Sunday. So we recorded this session with him. So still, we're going to have a very insightful description about acupuncture as a form of energy medicine. And he also still gave us some techniques that we can use at this point in time to release some stress, right, Pink?
Yes.
So let me give you the first half of things that we have to know about Doc Mac Cueto. Okay, so I'll read this. Dr. MacGerald Cueto is a pioneer graduate of Manila Theological College, College of Medicine, and holds a professional doctorate in metaphysical science, MSCD, University of Sedona. MS in Asian Health Practices, MSAHE, UERM Memorial Medical Center Incorporation, and he looked his pre-med in Medical Technology, BSMT San Juan de Dios Educational Foundation Incorporation. He was consistent scholar in his medical master's and doctorate degrees.
Oh.
He was also a recipient of the Philippine Council for Health Research and Development, Accelerated Science and Technology Human Resources Development Program, scholarship under the Science Education Institute of the Department of Science and Technology for his master's degree. He is reviewing for his physician licensure examination, MD, a registered medical technologist, RMT, a certified naturopathic practitioner, CNP, a certified acupuncturist, CAC, and an acute detox specialist, ADS, in the Philippines. He completed his biosafety training for COVID-19 at the University of the Philippine National Training Center for Biosafety and Biosecurity, telemedicine, as well as COVID-19 mechanical ventilation and clinical management from Harvard Medical School, psychological first aid from Johns Hopkins University, traditional Chinese medicine, as well as nutritional epidemiology and planning from UERM Memorial Medical Center, genetic epidemiology from University of the Philippines College of Public Health, advanced research ethics from University of the Philippines College of Social Science and Philosophy, Jules Scalp acupuncture from Yongho Center of Acupuncture and Chinese Medicine, Malaysia, Anti-Aging Acupuncture from the World Federation of Acupuncture, Moxibustion Society, Acupuncture, Jade Mountain Chinei Chang and Inam Tao Ren Therapy for Psychotrauma Training from the Integrative Medicine for Alternative Healthcare System, INAM, Philippines, and Ear Detox Acupuncture from the National Acupuncture Detoxification Association, NADA, Philippines. He has also completed additional training in evidence-based health policy making from DOST, PCHRD, and Ateneo de Manila University, Institute for Philippine Culture, Visual Arts Heal Psychotherapy from Miriam College Department of Psychology, and Intensive Integrative Family Therapy from Care and Counsel Wholeness Center. He further trained under the several respected mentors for several healing modalities such as COVID-19 energy healing specialist, Sheng Gong teacher, Usui Reiki Royoho Reiki master teacher, Kundalini Reiki, Advanced Kundalini Healing, Ascension Reiki, Hiyang Filipino, Spiritual Healing, Crystal Healing Therapy, and Access Energy Healing. He has also completed seminars and workshops on medical feng shui and astrology, intuitive tarot counseling, past life therapy, medical intuitive development, EMDR, psychotrauma management, and Steiner, Waldorf early childhood education. He is a respected lecturer on the Philippine indigenous health practices, acupuncture, metaphysics, Reiki, traditional Chinese medicine, and naturopathy in the country. Currently, he conducts lectures at the Philippine Institute for Naturopathic Sciences at the Graduate School of UERM Memorial Medical Center Incorporation, as well as holds private clinic at Living Life Well Integrative Medical Group. Wow.
Oh, wow.
That's so
Biologist,
wow, yes.
Doc
So
Mac.
we are so thankful and glad that our doctor, Dr. MacGerald Cueto, even how busy he is, as you know, right now, lab, all the medical physicians, they are all really on the field, so busy, but still he gave us time last Sunday. His generosity, his big heart, he provided everything that we believe our viewers will benefit from this program today. So maybe Pink, you can tell also muna bago natin ilabas yung
Sure, while you're
preparing this, ilabas natin yung video. Maybe you can tell to our viewers bakit wala si Dr. Janice, 'di ba? While I'm preparing something for the video.
So of course, just like Doc Mac, Dr. Janice also told us last night that she has an emergency meeting today. That's why she won't be able to be with us today in the live. And of course, again, because she's a physician, she's a dermatologist, she's also doing rounds or on-call doctor in some hospitals. Kaya, ayun.
Kaming dalawa lang nandito.
Kaming dalawa lang.
Yes. So, let me go about this. Wait.
Okay.
Yes. Let me check first.
So I'm really excited to share this video, our interview with Doc MacGerald Cueto, because he really provided us everything that we need to know about acupuncture, like how is it painful, or is it how many sessions do we need to experience the effectivity of this modality, or what age, is it best for this kind of modality, or this kind of this acupuncture to us, or if so many questions, like we gave him for like almost 10 or more than 10 questions last Sunday.
Okay, Pink. So let's see if I can share this now. Let's check first. Let me go to the share screen and wait lang.
It's okay.
Okay, go back to this and then
There you go. Perfect.
ayan, wait lang ha. Let's start from the very end.
Mhm.
Okay, so
And then
I hope the viewers,
Zoom screen now.
okay, let me stop first again. Okay, and then share and then
Good morning, everybody. This is Dr. MacGerald Cueto. I am a medical physician, general practitioner, but I am connected with several institutions. One of them is the Philippine Institute for Naturopathic Sciences, which I am connected, and one is a medical center and the graduate school. Okay, so I am a physician, and I also am specializing in traditional Chinese medicine, acupuncture, naturopathy, and metaphysics. Today, I am also asked to talk about one of my specialties, which is acupuncture. And acupuncture is well known throughout the world. So acupuncture actually started with traditional medicine in the Oriental area, or particularly in ancient China. So acupuncture comes from the word puncture. So there are several meridians or channels of energy in the body, and husha daluyan. So it means that there are certain areas wherein energy or nerve endings or neuromuscular junctions converge. So when you puncture certain areas with that, you use really very thin needles, very thin. So when we thinner than your hair. Okay? So very thin siya, filiform. And when you puncture that, you stimulate those neuromuscular junctions. And those neuromuscular junctions goes into a cascade at nagkakaroon tuloy ngayon ng uh, effect wherein naglalabas ng endorphins, naglalabas ng substance P, naglalabas ng mga neurotransmitters, and nagkakaroon din ng neurofeedback wherein pain is reduced or eliminated. Pwede din nagkaroon din ng psycho-immuno-endocrinology process wherein you stimulate certain organs in the body, we call them endocrine glands, para lumabas yung hormones. Pero majority is touch with the puncturing of certain areas. So yung areas na yon has pooling of life force. So we call it qi in Chinese, or ki in Japanese, or prana in Sanskrit. So all of those are pooled into those little points wherein either you press or you puncture. But most people know acupuncture for doing that. Is it painful? It depends. Kasi nga, depends on the practitioner actually. Pero different trainings kasi nagkakaroon ng different trainings nangyayari. In the Philippines, we follow the motto, no pain, all gain. So it means that we minimize the pain sensation of puncturing kasi we were trained to do that. I have clients naman who comes from China and other Oriental areas na ayaw nila ganun. Gusto nila mabigat ang kamay. Dapat may nararamdaman sila. But for Filipinos, hindi. And also for some Westerners. So we follow all pain, no gain? No. No pain, all gain. So basta we do I think para hindi kayo masyadong masaktan o hindi maramdaman. So magagaan ang mga kamay namin. And how young can we get? Personally, I have a 2-year-old that I punctured. Then as young as 96 years old, I have punctured that personally. Okay. So it depends on anything in between. Pwedeng babae, pwedeng lalaki. And from currently, majority of my patients are for pain, but I also see other pains that are practiced in the general ng acupuncture currently. So, do you have any questions about it?
Yes, Doc. No, thank you very much for a very detailed description of what acupuncture is and yung mga common questions ng mga people about acupuncture and also yung history niya. But Doc, before we dive more deeply into acupuncture, can you at least share with us your personal journey? Kasi yung ano tayo dito? Yung iyong passion for healing is not just for allopathic or the conventional medicine, no? We know na una ka into alternative healing that comprises energy, yung energy healing, metaphysics, traditional Chinese medicine, and eto nga acupuncture. May we ask you, Doc, ano po ang naging journey mo? How you stumbled upon this healing calling, no? When did you start? Gano kakabata na naramdaman mo na tinatawag ka to heal, to help heal people, not just people, but the world in itself and Mother Earth also. So, Doc, can you share us your personal journey
So
to your calling?
So I will try to put it in a very, very brief way. Okay, kasi kung autobiography yun, marami tayong masasabi dyan.
For sure, very interesting yung biography mo, Doc.
I am a corporate person at the turn of the millennium. So from 1998 to 2002, I am connected with a multinational company, actually two multinational companies. But during those times, I'm already delved into energy medicine. Curiosity lang. I was curious, so I went into the metaphysical side, the popular metaphysical side, psychism. So mga awakening the third eye, bending of spoons. Wala, curiosity lang. So it all happened in the early 2000s. So, okay. So after that, I went into several trainings para tapusin lang. Yeah. Kasi curiosity lang yun eh. Then they said that since I could bend spoons down, which ngayon hindi ko nagagawa ulit, I could become, kasi nafo-focus yung energy, you can become a healer. So I just let it pass. Para bang dumaan lang sa utak ko yun. Then during one of sessions, I met my first spiritual mentor, and she taught me the energy healing technique, Japanese healing technique. It's Reiki. Then from there, small ball na, I met another spiritual healer who naman is more on metaphysics. So he's actually an AB psychology undergrad person. So ang dami niya na natutunan sa kanya. And he's really into metaphysics, wherein na ano naman ako. I was curious naman, and he really encouraged me naman to go into my doctoral, which is first metaphysical sciences. Okay? Nung nag-start yon, and he also encouraged me to do into healing. Kasi nga, during that time, I was in a healthcare company that multinational. Then, I think to stroke of circumstance, I had to leave. So during that time, na-inculcate naman sa akin that what would I do? So I just pursued lang. The Spirit has, and my guides, and the Lord has given me a chance wherein I had to pursue what I was pursuing without any restrictions. So when I did that, I went into another master's degree from another famous medical institution of medicine. And at that time, I said, okay, tapusin ko na to, pumasok na ako doon. I got a scholarship, full scholarship with stipend pa. So
wow.
it really helped you, no?
Yes.
I transferred from the corporate only with little savings and everything that, and I went into talagang traditional medicine, and I got a scholarship pa to study my master. And then I went into acupuncture pa rin because of of my mentor again, because I was sunod lang ako sa kanya. I let the spirit or let the God give me my way. And when I look at that, God really, really helps you when you just ask. And He will give you where you should be. Okay? So, yun yun. So, for the past 20 years, I have been there. I have been led by the Spirit, led by God to where I should be in. And one after the other, I go into. Merong mga stumbling blocks. Pero tuwing nakikita ko, when I always follow my spiritual calling, I always get a scholarship.
Oo nga.
To study that, di ba? So,
It's a sign. Clear sign that you are led to that path.
And when you look at it, I was also given a scholarship by the government, di ba? So, from a very prestigious.
Yes, Doc.
And then I also get scholarships from abroad. Nakita niyo yung mga, if you read it,
yes, Doc.
all of those are under scholarship then. I did not really pay much except for my travel and also board and lodging.
Mm-hmm.
So when you are led by God to where He has given you, everything will be clear. Okay? So from there in, nakita ko na din na medyo follow na lang. So the next step would be to be more of a holistic medical practitioner. And I also prayed again kung tutuloy ko ba yun o hindi. Kaya I went into allopathic or Western medicine, if you want to do it. Maraming nagtanong bakit, because I'm already respected in my field. Pero why start over again?
Yes, Doc.
And I said, I think it will be more in service to humanity. And I think when you are led by the Spirit, even from a blockage, you will also be given much. And I'm also given a scholarship for my medical practice.
Wow.
Diba? So talagang, may
purpose.
May purpose talaga.
Yes.
And even my specializations, most of them are given free. I'll just have to give more service to humanity. So may return of service yun. Even the government, may return of service ako doon. And nakikita ko naman, because of those scholarships, I was able to uplift a lot of people from their thinking na lowly lang yung traditional and naturopathy. Ngayon, very respected na ngayon siya in the Philippines. And they're always looking for persons to talk to. Sino ba yan? And of course, there is Dr. Elizabeth Nicalier, no? Diba? The naturopath.
Yes.
And then, right now, they also talk to me na hindi nila alam na ako yung naturopath and I'm a medical doctor. They know me as the Reiki teacher and the acupuncturist. But when they think of naturopathy, ay talaga, pati yung pinasok mo, nako, tumaas na naman ang level. Naturopathy. So ganun yun. So nakikita ko na when you are led by the Spirit, led by God to where He is healing you, He will be given to you. And even though may blockage nga, as I said nga, ulitin ko ulit, ngayon, you will be led there. So my journey is very colorful. A lot of ups and downs, pero marami namang changes. And if you really look at it, and if you follow mythology, it's like the mythology of a hero. Okay? Now you go into battles, you have a lot of changes, but you always come out victorious.
That's right.
And you don't do it alone. You always have somebody with you. So, yun nga nakikita ko sa inyo. For those who would, kung nabasa yung aking CV, my curriculum vitae, it's a mouthful, and most of that I gained through the grace of our Lord and to God alone. And right now, I'm happily being asked to serve again most people during this time.
Yes.
So right now, through one time at another, I am here to serve all of you. So hopefully, after all of this, we will see each other again. Okay? So yun. Na-inspire ba kayo o masyadong metaphysical ang
Doc,
dating?
that is very inspiring. Thank you very much. Hindi lang kaming mga host ang na-inspired. I'm sure lahat ng viewers natin na-inspired. This is a perfect example, Doc, ng natawag natin na destiny, di ba? Ng calling. You just need to follow. Meron at merong mga stumbling blocks, but if it's for you, yun talaga yung path na nililid ka, ma-overcome at ma-overcome. No? I like your description na it's a hero's journey. Lahat naman tayo, Doc, di ba? Everyone ay may sariling hero's journey. Iba-iba nga lang po ang path, iba-iba nga lang din ang experience. But nonetheless, ang life natin here sa Earth is to serve other people. No? So thank you very much, Doc, for that very inspiring and beautiful story of your journey to healing. I'm sure meron ding questions ang co-host ko, Pink and JM. Go ahead.
Go ahead, Pink. Do you have questions for Doc Mac?
Okay, thank you for that very inspiring sharing of Doc Mac. But I have other questions here. So, what is acupuncture best for? So, ano yung mga sakit or case na magandang acupuncture talaga yung i-apply natin or pang therapy natin. Yun.
Okay. Currently, merong 36 illnesses and diseases na officially recognized by the World Health Organization that acupuncture can be used for. Marami doon ay for pain, another doon is for hormonal imbalances, and a lot of those are also for changes in common problems or health problems in the community, like hypertension, like diabetes, hyperthyroidism. Pain is there, and majority of the 36 is about pain. Either gynecologic amenorrhea problems, dysmenorrhea problems, and also ang gold standards for pain is toothache. So nagawa ko din for toothache yan. Pero currently, nag-evolve na yun ang acupuncture in the Western world. But in Oriental countries, particularly that of Korea, Japan, and also China, acupuncture is a staple in all medical interventions. May it be non-communicable or communicable, pediatric, gynecological, or andropause or andrological. From infancy nga to senescence ang acupuncture. Ginagamit yan for bedwetting for children, to control of height, and also for beautification, facial enhancement, and also weight gain, for weight loss. Ginagamit din yan for pestilence. Kaya ngayon, yung mga infectious diseases natin ngayon, ginagamit din siya. And also for neurological rehabilitation, for stroke, for epilepsy, for infertility, and also for men's sexual health. So marami siyang ginagamit in mainland China, Japan, and Korea. But officially, we have 36 items that have been officially given by WHO. Majority are in the pain syndromes. And some are for internal medicine, and very few ang pediatric and OBGYN problems. May tanong pa?
Do you have another question, Pink, for Doc Mac? Otherwise, I'll ask him na.
Yeah, I have another question.
Okay.
So, meron kang risk associated with acupuncture, Doc?
Risk. Like most interventions, kahit naman yung ating homeopathy, tsaka herbal medicine, pag yung practitioner ay hindi well-groomed, hindi siya agad-agad magkakaroon ng effect. Okay? Pag mali ang diagnosis mo, of course, mali din yung effect ng intervention mo. For example, for acupuncture, when may mga syndromes kaming pina-follow for traditional medicine, if na halos magkakapareho. For example, deficiency of qi and deficiency of yang qi ay halos magkapareho. So you really have to understand. And also the practitioner in training. When you are trained enough to handle patients or certified, mababawasan yung chances for you to magkaroon ng adverse events. Okay, so may certification or licensing ang acupuncture in the Philippines. And it would be prudent for you to go into a certified or licensed practitioner para mabawasan yung risk. Okay? So, kasi kami may risk yan kasi we use needles. Siyempre, merong bleeding, merong hematoma or bruising. So, it's all about the technique, and the technique is practitioner dependent. So, nasa ganun lang. Also, na-eliminate namin yung blood-borne pathogen transmission. For example, hepatitis B, HIV, hepatitis C, and other blood-borne infections have been eliminated because we use disposable stainless steel needles. So wala nang rest of that. So ang karamihan nangyayari ngayon is yun nga, may konting slight ache, hematoma or bruising, and also minsan nagkakaroon din ng small pain, pero hindi naman ganun sabihin. It's all practitioner technique. So when you are certified to do acupuncture, you are certified by the government of the Philippines to do it. So you have passed by the standards. And those standards are nationwide. And right now, we are very strict on acupuncture on that. So we were the first to be certified by the government of the Philippines. And we are very strict with our accreditation or certification process. So, yung mga dating nagkaroon ng problema, ngayon na halos na-eliminate na namin with certification, and we have now a common curriculum na tinaas na namin yung level. So, it is now harmonized with ASEAN, but it is still not as high as China. Kasi ang China kasi, it's bachelor level. Bachelor level kasi acupuncture doon. So, it's 5 years. Para ka talagang nag-medical profession, and meron ng mga specialization in acupuncture. Acupuncture for OBGYN, acupuncture internal medicine, pediatrics, and also oncology and musculoskeletal. So right now, when you are certified and you in the Philippines, it means na-minimize yung risk. So ang common risk lang talaga is bruising, a little pain, and a little changes in your sensorium. Palagi kang antukin. So yun lang naman ang nakikita ko doon.
So Doc, it will not make us bleed?
Bleeding, okay. There are two types of techniques. I sometimes intentionally bleed patients with ACS, acute coronary syndrome. Ano yun sa layman? So, inaatake ka sa puso.
Okay.
I-bleed talaga kita para mawala, para hindi magtuloy. Meron din talagang merong hypertensive crisis. Nagsushoot up ang blood pressure mo to 200 over 150. Talagang i-bleed kita kahit ayaw mo para bumaba yan. So, magbe-bleed ba siya? Some do. Around 20% of the time of normal acupuncture, you bleed. But with times for emergency acupuncture, for example nga, yung acute coronary syndrome, inaatake ka sa puso, we really bleed certain points para hindi magtuloy. And also for hypertension crises, thyroid storms, we bleed certain points pa rin. Again, not everybody is certified to do that. Majority that we were trained are already trained enough at mukhang kailangan pa mag-train pa marami. So I really have to multiply myself, and we will do with that. We have trained that a few lang yata, 10 lang yata kaming trained to do that in the whole Philippines. And majority of us are based in the hospital and some are based in the far-flung areas. So yung bleeding, we have to quantify what it is. Well, it is a side effect around 20% of the time, but it's a welcome side effect for us who are in the emergency room. Okay? Kasi nga, it's used for another technique. And my teachers also use it for emergency purposes. Bleeding. We call it bleeding or wet acupuncture.
So masakit siya, Doc? Will it
Masakit siya depending na dun sa technique. So currently, I am trained to do very, very minimal pain acupuncture. And I have trained a lot of people to do that too. But if you put me into Taiwan, into China, I have to use the China style, which is very heavy. Mabigat ang kamay. Dapat unang pasok mo, ramdam agad. So parang may slap in the hand. So kung masakit siya, you will feel the chi. When you feel the chi, there is an electrical stimulation. Parang may konting kuryente, mild steam. After 0.5 seconds, tapos na yon. Others naman, ang bigat po, Doc. That is also a chi. So yun ang mga nakikita namin. But when you explain to them that itong mararamdaman mo, nothing to worry, they would understand. Actually nga, naghahanap na nga yung ibang pasyente ko, bakit po hindi nagdudugo ngayon, Doc? You are compliant with your antihypertensives. So yun yun. Kaya hindi nagdudugo ang points mo ngayon for our antihypertensive points. You are... Tapos, Doc, bakit hindi na ako inaantok? Kasi you're compliant now with your anti-diabetes drugs. Sabi kong ganun. So, and you are now doing. So, hindi ka na masyadong nagkakaroon ng side effects on that because you're compliant. So, nakikita mo mga compliant na patient. When you take compliant, masunurin yan, ha?
May pasaway po ba, Doc?
Ako, ang dami. Karamihan na yung mga kabaro namin. Kaya basta nurse, doktor, pasaway yan.
Okay. All right. So, thank you so much, Doc. No, to just break it down, as you were saying, Doc, no, may standardization din pala dito sa Pilipinas. That's why you're encouraging to avoid or to experiencing minimum risk. Go to the certified acupuncturist talaga who went through the training and get standard talaga by the government na, di ba? And then, yung wet acupuncture or wet na sinasabi ng bleeding, there's a certain condition kaya kailangan mong pa-bleed yung mga certain points ng tao pag pumunta sa iyo, like sinabi mo ay coronary heart disease or yung mataas yung parang mataas yung blood pressure, kailangan i-bleed mo siya talaga. May dahilan kung bakit yun ang gagawin mong technique. So, hindi pala basta lang magpa-puncture ka kasi 'di ba dati parang yung thinking ko nga daw, kung saan yung masakit i-puncture mo, parang ganon. 'Di ba? Ito, if you really go through and study acupuncture as you mentioned nga daw, sa China nga 'di ba? It takes really 5 years as if you're studying a medical course talaga, 'di ba, Doc? So ganon ka tedious yung pag-aaral ng acupuncture. And you also mentioned here in the Philippines about 10 or how many lang kayo na certified dito na you're saying also na kailangan mo na rin talagang mag-multiply ng sarili mo. Yes, Doc, I agree to that. So kaya yung pins, Doc, miss na miss ka na namin. Simula nang naging busy ka po sa bagong calling or sa calling na tinawag ka ngayon, na-miss ka talaga ng mga estudyante mo sa pins. I personally had a great and wonderful experience to be one of Doc Mac Cueto's student in pins. Napakadaming tinuro niyan about naturopathy, ethics of naturopathy, some indigenous healing modality here in the Philippines, Doc, di ba? Yung mga tawas, you remember that experience? We had that in pins, Doc. And ito, yung mga acu-detox, no? So,
Yes, Doc, I really agree na kailangan mong i-multiply yung sarili mo. So I hope one of this day when everything is settled, baka magkaroon ka ulit ng schedule sa PINS to teach this because I'm pretty much sure marami naghihintay na estudyante. Anyway, yung mga online classes mo in PINS, still ongoing po yan. Maraming nagtitake ng course natin. So definitely yung mga tinuro mong yon, marami nang nag-aaral, marami nag-a-apply na. So that's a very wonderful to know. But to have a follow-up questions, Doc, in relation to acupuncture, can this acupuncture, other than, halimbawa, a person is experiencing some condition, apart from acupuncture treatment, can this go hand in hand with other modality, other treatment, o kailangan po talaga when you take acupuncture as a form of treatment, ito lang ang gagamitin mo. So, kasi there are other treatment that you cannot use. It has to be ito lang tong treatment na to para ma-determine mo talaga kung nagtitake effect. So, what about this acupuncture? Can this be working hand in hand in a one condition, or halimbawa, a condition of diabetes? Apart from this acupuncture, pwedeng partner with homeopathy, naturopathy, or other healing modality, Doc?
Currently kasi, when we look at the patient, we treat the person, not necessarily the diabetes.
Yes, Doc.
So the person, we treat them, and when we treat them, hindi lang naman acupuncture works. Acupuncture works in immediately decreasing the hypertension and the hypoglycemia, or the high blood sugar, and prevention of all the side effects of diabetes or the effects individually. Pero hindi lang naman siya dapat doon. Acupuncture must be combined with other modalities. Ngayon, currently I combined it with medication nila, plus homeopathic remedies, plus counseling, energy healing, pastoral counseling to the side. So you really have to treat the person. So hindi siya diabetic patient, it is a patient with diabetes. So that is the thing. So in the Philippine setting, hindi lang yung pasyente ang kasama mo, pati yung pamilya. Okay? So dapat isama mo din yung pamilya doon. Kung ang pamilya with the diabetes, hindi naman pwede sa handaan, hindi kasama palagi yung may diabetes, di ba?
Yes, that's right.
Sa birthday party, hindi siya sasama. Hindi yun. You have social obligations too. We are social beings. So sasama ka din dapat doon. So alam din naman ng family at ng mga kaibigan niya na may diabetes to. So huwag niyong kutsain na hindi pwedeng kumain ng cake. O bakit kukunti lang kinakain mo? Lalo na sa piyestahan. Bakit yan ang kinakain mo? Ay, may diabetes. Ay, killjoy naman ito. Hindi walang pakisama. Kaya nga may kainan, ganyan. Pasko, birthday. So you really have to educate pati yung family na it's a lifestyle when you have a certain condition. So kasama dyan yung naturopathic emotional freedoms and emotional healings. And minsan meron tayong psychological first aid or emotional first aid pa doon. Kasama doon. Kasi nga those who have chronic illnesses are very depressed. So syempre, rather than use first psychiatric interventions, emotional first aid. And majority, it has been studied that 95% who are given emotional first aid or psychological first aid does not need any psychiatrical intervention afterwards. So na-unburden yung hospitals with liaison psychiatry problems. So when you do emotional first aid. So lahat yan kasama with naturopathy training dapat. Okay? So acupuncture, it's a modality that can be adapted or incorporated in the medical profession, in chiropractic, in naturopathy, and also in homeopathy. Okay? So lahat tayo magkakasama. So kasi we treat the person, not the disease. And acupuncture can help. Okay. So, but there is an exemption. Okay. If you are responding to disasters which I had, and there are no medications and homeopathy is very, very limited, homeopathic remedies, meron ka nga pero konti, acupuncture can do something. Yun muna. So I have that in disaster relief. Wala kaming dala. You just have needles with us. Or katulad ng ginawa ko sa inyo, di ba? You have ear seeds. Yun lang dala natin.
Yes, Doc.
Because you cannot bring the whole thing. Hindi tayo pwedeng magdala doon ng tent and magdala ng pharmacy doon and make our own homeopathic remedies on the spot. May timing yon. So as when we do for disaster relief and humanitarian disasters or natural man siya, acupuncture has been used in the Philippines and we have been the test case for that. Nagugulat nga ang ibang bansa, ay pwede pala acupuncture sa natural disaster relief? Oo naman. We have done that. And for acupuncture to be used alone, generally hindi. Okay? Kasama siya ng other interventions. It enhances the interventions. But when it comes to certain conditions like disaster relief, when there is no other interventions available, kundi acupuncture lang at saka emotional first aid, kinukumbine yung dalawa. Okay. Kung wala, kung talagang ayaw mag-speak up, which most Filipinos and Asians do, kahit yan, maraming fill up na yan, acupuncture na lang, walang salita. Tatay, nanay, upo lang mo kayo dyan. Pwede ko kayong tusukan para mabawasan ng tension ninyo. Hindi yan magsasalita. Tatango lang yan. And after you do acupuncture on them, after the first session, they will become to open up. Then you now go into emotional first aid na.
Okay, Doc. So, pwede pala siya sa mga disaster relief na parang pwedeng emergency na rin, di ba, Doc? Pwedeng pang gano'n na rin kung yun na lang yung meron kang dala for that, no? Tapos, that's right, I really, hearing these words again from you or hearing this statement, it's like bringing me back the memories of when I was studying in teens, that you treat the person as a whole, not the disease of the person. That's why we treat them as a whole. That's why holistic, it's very holistic ang approach natin. So that is a good reminder, Doc, no, na parang we as naturopaths, we integrate and adapt all the kind of modality as long as we know that what can benefit our patient. Kaya inaaral natin to. It's the entire system of naturopathy that includes traditional Chinese medicine, acupuncture, homeopathy, and even mga energy medicine nga, Doc, like pranic healing, theta, and Reiki, di ba? So lahat yan as long as that it can help the person to become better. So yun yung lagi nating code of natin sa naturopathy nga, Doc, di ba? So by saying that, Doc, in a nutshell talaga, what is the purpose of acupuncture? I mean, I know for a fact, homeopathy, di ba? May mga reason for being yan, bakit nandyan sila. But can you share with us and with our viewers also, why, what is this acupuncture and what is the purpose of this in the total, in relation for the total health of a person?
Okay, it's okay. Yung talagang ultimate goal or aim of acupuncture is to bring back the body to its original state of perfect health. Okay. So acupuncture, if you are diseased, if there is a blockage in your energy field, acupuncture will help unblocken you or release that stagnation. Para bang binubuksan mo yung dam ng tubig. But ang ultimate goal of acupuncture is to bring back your body to its pristine area of perfect health, yung original state natin. Of course, kung meron kang, if you're carrying a disease or illness with you, it may take some time, lalo na kung chronic illness yan. So, kung acupuncture alone, yes, but medyo matagal yon. Kaya when you talk about natural healing, hindi lang talaga one modality lang yan. So, the ultimate purpose of most natural healings, again, is to go back to perfect health. And acupuncture is not an exception.
Mhm. Okay, so I hope that answers the curiosity of our viewers. What is the main purpose of acupuncture? But I believe Dr. Janice will also have another question to Doc Mac.
Yes, Doc, thank you. Very in-depth na actually yung explanation mo, Doc, no, when it comes to acupuncture. So, na-limit na yung mga questions natin pagdating sa acupuncture. Pero, Doc, meron bang limitation ang acupuncture? Are there people who cannot undergo acupuncture, or are there any conditions bukod po dun sa mga nabanggit niyo na kanina na hindi pwede po ang acupuncture?
Okay. Currently, if the patient is already on the very frail state, what we call, nandun na siya sa yin-fire syndrome, or extinguishing na yung kanyang yin energy. When we talk about that, medyo very, ano na siya? When we talk about medical terms, nasa multi-organ failure state na siya. Okay? So, not more medical.
Or naka-life support, yun po ba ang ibig sabihin, Doc? Life support.
Multi-organ failure na. So, meron kasi naka-life support na nasa SEERS pa lang eh. Yung systemic inflammatory response syndrome.
Yeah,
Okay pa yun, okay, naka-CARS pa lang.
Okay.
Okay, kaya pa yun.
Procedure
But when you are already on the multi-organ failure area na, medyo acupuncture may not be as quickly used. You have to use another form. Generally, we use herbs, powerful herbs to do it, not acupuncture generally. Also, I have found that when the patient is already on multi-organ failure state, energy medicine rather than acupuncture is more effective.
Acupuncture enthusiast.
Kasi you're not already moving towards the meridians already. You're really tapping into the energy bodies of that person.
Okay.
The 3 levels and the 7 levels of the energy.
Okay.
And when the patient is already on yin fire or already yin depleted, when it's yin depleted, yung talagang putot balat, talagang dry as a bone, emancipated na, sunken eyes, talagang nakikita mo na talaga, nakita mo yung already chronic ill, or in our case, naka-multi-organ failure na. I don't personally use acupuncture. I use energy healing more.
Oh.
Yeah, thank you for that, Doc. I think naman kung ganyan na rin talaga ang situation ng isang pasyente, difficult for any modality ng healing, even with allopathic, that's really difficult na rin. Pero kung if a person, Doc, would want to experience, first time would experience acupuncture, what to expect po when they come to your clinic to have a session ng acupuncture?
Well, ang una-una ko sasabihin, you have a pain tolerance, and majority of your expectations is usually false. Hindi siya kasing sakit na in-expect mo. Okay? Kasi they always equate it with vaccination eh. Masakit kasi yung nagpa-inject ko ng vaccine, masakit talaga yun. Okay, lalo na kung deltoid. But the level of pain is tolerable for most people when you do acupuncture, and expect that you will be undergoing some form of acupuncture, that you will be lying flat or seated for at least 30 to 45 minutes. Okay. In the clinic setup, it depends on the area and the disease pattern of the patient. Kung pati yung spinal points along the spine will be punctured, or the limb points, the upper and lower limb points will be used. I have trained some of my students to use the ear as an acupuncture area para at any given moment they could puncture the ear. Okay? For areas na kailangan mo malaman, pwedeng gamitin yung other areas, which we specialty yun. But generally, we use the axillary points, the extremity points, pala, and also the spinal column points, near the spinal column points. It equates to the spinal nerves, yung 31, and also the areas in the limbs wherein you will have an illicit response. Maraming NMJs dun sa hands and feet. So we usually use that and also the upper and lower limbs. So kailangan bang mag-undress? Not necessarily. But if you really have to be undressed, we have sheets. There is privacy that is given to you. In China kasi hubad sila. Harapan mo, wala silang pakialam. Mga babae na lalaki, hubad yan, tanggal lahat. At dito, kung medyo modest, so bibigyan mo syempre ng bathrobe, patient gown. But if you see me in China, gano'n ako, teka lang muna. So, ganun yun. So, ngayon, it's controlled. Okay? Don't be afraid because of the pain. Kasi majority of, masakit mo ba? Then when you, hindi pa ganun kasakit na iniisip ko. So, a lot at least 1 hour when you are doing acupuncture, especially if you are on your first visit. Kasi explain pa yon yung treatment protocol sa'yo. Tsaka syempre naman, we're not in China wherein we just take your pulse, look at your tongue, sabi you, pinamay ka na. Ganun ka bruise ko kasi sa China eh. Kasi I see patients, then 10 patients in an hour. So, stick out your tongue, take your pulse, higa. Ano na yun, walang finesse. All the bedside manners that you're taught in health, in school, wala doon. And so, but here, we really respect the patient. We follow protocol. We explain everything to you. And it's up to you want to continue or not. Now, generally, we give a numerical figure here. Expect to have at least 10 sessions for the Filipinos. And we will try to check again kung kailangan mo additional. But generally, I said, expect around 10. Pero some always 1 or 3 magaling na, hindi na nabalik. I see them after 6 months ulit kasi masakit ulit. Or I see them once a year, or I see them after 5 years. Sabi, ano na yan sa'yo? Ba't ka bumalik? Masakit ulit eh. So, it really depends. At meron naman dyan, I see them almost every week, twice a week. And they're not really getting well acupuncturally. But as a naturopath, when you probe in, yung pala iba ang gusto, it's gusto nila company. They would like to be with someone that will really listen to their problems. So kasama din yun doon. Kaya nga tayo, we treat the person. So when you go into, again, acupuncture, well, in my case, because I'm a naturopath first before a technician, is that I treat the whole person, and most of us are naturopaths in the Philippines treat the whole person rather than the disease again. So yun ang makikita mo when you go into an acupuncture session. So a lot, at least an hour, and expect na you'll be treated like an ordinary person doing medical consult. Maraming history taking, maraming diagnosis, may palpitation, may thinking, may looking of your face, changing every diagnosis, same thing.
Yes.
The same medical consultation, kaya lang it's more holistic ang dating namin.
Yes. Wow.
Thank you, Doc, for that description, no? For giving us a picture of how a consultation or an acupuncture procedure is done in the clinic. I myself haven't experienced yet an acupuncture, mainly because takot lang din po ako, no? Takot lang din yung common na misconception na baka masakit, no? Ayoko masaktan sa body, no? But this is very interesting, Doc, kasi yung mga questions actually namin, the questions we have in mind to ask of you na address mo na rin naman po kasi I think na re-receive mo yung thoughts namin energetically. So as you go with your discussion, yung mga points or yung mga questions na gusto sana namin tanungin, nasagot niyo na po. So I think JM will wrap up our session for today.
Yeah, but that's true. I agree to Dr. Janice. Thank you so much, Doc Mac. You provided a very insightful description about acupuncture, and you even gave more than what we have in our mind to ask you. And yeah, I agree that in fact it's in our mind, pero sinasagot mo na along the way with your description. Sabi ko nga po sa group chat namin, nahuhulaan ni Doc Mac yung nasa mind natin. Na parang that you're all said everything about we want to know. I'm sure also viewers na address mo na, Doc. But for a final note, Doc, with what's happening and with what our current condition right now, this pandemic situation, can you give us and our viewers an inspiration of how are we going to brace this situation with so much positivity? I mean, positivity in a pragmatic level. It's not like it's all in the mind, Doc. I know you're very good at that, Doc. I experienced that from you during our classes na itong mga nangyayari ngayon sa atin, sa situation natin, we are facing this pandemic, Doc, and this is real, right? What can you say to our viewers to empower them and to give some light to this situation? Go ahead, Doc Mac.
Okay, so currently ngayon, most acupuncture clinics are in 20% capacity. So, syempre, hindi ko kayo makikita sabay-sabay, no? So, nililimit din yung number because of community quarantine issues. Very fit yung clinic ngayon. For most people, kailan matatapos ba to? Well, it will take time. But right now, it's better rather than dwell on the current situation, which nagawa na natin for the past 4 months. Since March 15, we have been dwelling in our homes at lahat tayo ngayon natatakot, nagagalit, frustrated na. And remember, even though medyo malayo, pagdating na din tayo doon. Okay? There's always hope at the end. Medyo mahirap lang talaga siyang intindihin, pero may hope pa rin yan. Kung nagagalit ka, it's natural. Ilabas mo lang yan naturally at saka in a way. It is normal. Pag hindi ka nagagalit, hindi ka normal. Normal lang magalit sa sitwasyon. Okay? Do not suppress.
Yes.
Ilabas mo yan. Ngayon, pag hindi mo kaya, you can always do certain acupressure techniques for you to pacify yourself. Una-una, if you look at your hand, and this is the second digit, you press this area. This bone, this bone, okay? Dito sa may palm area. Diba may fleshy part between the thumb and the index finger? You press that very, very tightly hanggang mamula. Okay.
Oh.
Okay.
The fleshy part, Doc. Yun
the fleshy part. Okay.
Parang ito, Doc?
Yan.
Ito, yan. Okay.
Here, this area, malapit sa gitna, dito.
Abo, yan.
Press mo yan whenever
Left hand or right hand, Doc? Regardless.
Textbook, kung lalaki ka, you press the right. Kung babae ka, you press the left. Pero in actual practice, doesn't matter. Okay.
Masakit, Doc, ba't gano'n?
Oo, tense tayo lahat eh. It's a tension point. Okay. So you press that hanggang mamula. Okay.
Hanggang mamula.
Okay.
This is to pacify, Doc, your feeling of anger, di ba?
Oo. Actually, it is to pacify your anxiety and your feeling of pensiveness. Sorrow, actually. It's
Maraming na-address, Doc.
na-address yan. Pangalis ng kalungkutan.
Okay.
But kung
Ayan, pinipress ko na, Doc.
Pwede ko yun, pang-alis siya, pang-strengthen siya ng lung points.
Lung
ng lungs. At saka to expel the colon, yung mga contents ng colon natin.
Oh.
But on the emotional level, it is to dissipate sadness and to open us to new beginnings.
Okay.
Isang point lang yan, ha?
Yes, Doc.
Okay?
Some point lang may new beginnings na.
Gusto
Ang
ni
dami, di ba? Oo, sadness. May yung, hindi lang sadness, pati
Oo.
yung
And then in
beginning.
a physiological level, addressing the lung, Doc, also.
The lungs
And
and
the
the large
colon
intestine.
daw.
The colon.
The
Wow.
lungs and the large intestine.
And the large intestine. Okay, to be
Oh.
specific.
Now, the other way, pag hindi kayo makatulong, you have a point between your eyebrows and at top of the head, this point here.
Mhm.
Those who sinabi nilang midbrain or third eye or ajra, it's actually midbrain area, this area. In
Opo,
between your
Doc.
eyebrows, meron diyang depression. If you are natutulog ka na, it is to bring back your wandering spirit. Or if you're very agitated, it pacifies your emotions. Okay? So,
Okay.
when you look like here, yung nilalagyan ng siopaw, bola-bola ng, ano joke? You made that
Baka
dyan, okay?
Yan ang na-miss natin kay Doc, yung humor.
Hindi mo siya i-press.
Hindi.
You stroke it upwards.
Upward.
Oh, parang facial massage.
Nakaka-relax na, Doc, no? When you stroke it, parang stroke it upward, no?
Oh,
So,
how
makakatulong
many?
ka.
Minimum
Yes.
9.
9.
Ay.
Or hanggang mapacify ka.
Mm.
And most people, those who are very agitated, will go back and sleep when you do that. Kailangan natin lahat yan. Lahat tayo is talagang stressed.
Correct,
So,
correct.
the point here and the point here.
Yes.
Okay. So, yun ang mga kaya natin gawin doon.
Kailangan, Doc, dito may pressure.
Wala.
Hagod lang, hagod.
Hagod
Parang
lang.
ano lang, feather.
Yes.
Feather.
Madampi
Soft
lang
and
siya.
smooth.
Madampi.
Okay.
So, yung mga ganyan, Doc, it doesn't have to have needles, no? Yung mga ganyan, kumbaga, pwede nang gawin yan ng individual, di ba?
In lieu of kasi hindi pa kaya yung yung magte-teleport ang kamay ng needle pupunta dyan sa inyo.
Yes, hindi pa natin ano yan. Wala kang ganyan.
So, for the meantime, we have to do that. For yourself, we call it self-acupressure for emotional wellness. And dalawa lang yan. Dalawa lang muna. Kasi para madaling gawin. So,
That's right.
the hands, and also in between your eyebrows, at top of the root of the nose here.
Yeah.
Ganun mo lang siya.
Yes.
Huwag kong madiin dito dito lang po sa natin, sa in between the fingers and the thumb. Tayo madiin hanggang mamula. Kasi nga, this pandemic, we have to strengthen our lungs talaga. And also, eliminate with our colon. Okay? Kasi yan ang dalawang nakikita natin. When you are clean in the colon and the large intestine, you are also strengthening your immunity through the lungs.
Oh, okay.
Energetically, ang sinasabi natin, it strengthens the lungs and also the large intestine. Emotionally, it dissipates sadness and opens for new beginnings to us. And also, yun nga, tinutulungan tayo sa bowel movement and lung functions medically.
Yes.
But here, talagang yan.
Relaxation.
Relaxation. Kasi tayo, stress. So in Chinese medicine, we are stressed. Your spirit has come out from the body and we have to come it back. You do like this again.
Okay.
Okay? You stroking that.
Yes.
Stroke lang yan. Wag mong gaganunin. Stroke lang yan kasi agitated ka.
Gentle stroke, no, Doc?
Yes.
Gentle stroke. Okay. So thank you very much, Doc Mac, no, for all this wonderful parang experience that we have right now with you, but never more than that, you gave techniques for us to parang take it away namin mga hosts. At the same time, mga viewers namin, no, na you're very generous always, all the time. Pag nagtuturo ka, nagbibigay ka ng mga ganitong talk sa amin, laging iniiwanan mo kami ng something that we can practice on our own. And Doc, again, my heart is filled with so much gratitude on your being your time for us, yung kindness mo. You're always been the same. Yung humor mo, Doc, that's why all your students in PINS are looking forward to have a class with you, kasi apart from the balance of you being lively in the class, so many information that you always give to your students na napaka-generous mong ibigay lahat, na ang gusto mo talaga mag-multiply lahat yung mga tinuturo, yung mga estudyante mo matuto para gamitin nila and to be of service. That's why kaming lahat dito sa PINS, we're very fortunate. And here in Naturopaths in Manila, we're very, very fortunate na alam namin, Doc, kung gaano ka ka-busy na yung pinag-uusapan natin to schedule your interview with us. But yet, nung nalaman mo na this is to bring awareness to people about this kind of modality, isiningit mo talaga kami sa schedule mo. Doc, thank you so much. Thank you very much, and continue to be a channel of blessing to others as you continue to be an anchor of blessing also. And sana marami pa pong mga katulad mo, Doc Mac. Okay, so to my fellow naturopaths in Manila, we can say goodbye now to our viewers. And go ahead, Doc Janice.
Yes, Doc Max, super thank you, no, for your goodness and your kindness, and for gracing us with your time, with your healing, and yung isa sa mga expertise mo. I cannot express my gratitude to you ng fully, no, but thank you. I'm your fan, okay? Hopefully we can invite you ulit for another show dito sa Naturopaths in Manila, no? I'm sure ang mga viewers natin is also looking forward to sa pagbabalik mo pa dito. Thank you very much, Doc.
You're welcome.
Yes, Doc, na-miss namin ang class namin with you. And sana when everything is okay na magkaroon ulit tayo ng class. But of course, we have online classes naman at PINS. So, ayan, I'll again flash it now. Thank you so much, Doc Mac, and very inspiring, very, ang daming insights. Parang bago lahat. Yun, reminder for us, especially for me, about acupuncture.
All right, so viewers, thank you very much, and see you again for our next discussion. We hope, and we really always excited to share everything that we know about naturopathy, everything we know about the energy medicine. So I hope you learned something today. So thank you very much.
Bye!
Bye!
All right.
And that's Naturopaths in Manila's version of acupuncture, a closer look. So of course, we all know na for some or most Filipinos talaga, acupuncture sounds, alam niyo yun, scary because of the needles. Pero I would personally dread it before. Pero a few years ago, I actually had acupuncture every week with my friends. We do it as a ho-ho thing or as part of our hangout lang, and for me, it's okay siya kasi holistic hangout eh. And naman, there's proof na it could help like a lot. Ako personally, again, kung bago ka sa holistic healing, no, as a type of treatment, acupuncture can seem a bit terrifying. But I believe in our interview with Doc Mac, our viewers already have an idea. How could pressing needles on our skin possibly make us feel better? And if it doesn't that hurt? Of course, medyo. Pero it's definitely not the overtly painful procedure we may be imagining and considering. And alam niyo yun, considering na it's been studied and practiced for over 2,500 years, trusted source. Acupuncture is really something, no? And some people, like myself again, we swear that acupuncture is parang a miracle to improving the quality of our life because it's able to treat almost everything from depression and allergies to morning sicknesses and cramps. And if you have watched our video today and listened to the acupuncture enthusiast, this prickly treatment sounds almost like a wonderful cure-all uh, treatment or thing. So, JM?
Yes, thank you for that again, Ping, for sharing your experience about acupuncture. Um, yes, thank you again, Doc Mac Cueto, for your generosity of your time, your insightful informations that you shared, and also some techniques that can be used by our viewers for all of us, especially when we are experiencing stress and some anxiety, or you could not sleep, di ba? So again, thank you so much, Doc MacGerald Cueto, and we hope that we can still interview you again for another topic. You have so many things to share to our viewers. So grateful that you gave us your time. Anyway, yes, I'd like to agree with what Pink said, that sometimes it can be really, really scary to try the acupuncture because of the concept that you're going to be punctured with needle. But for someone that who is trained enough and have well versed about acupuncture and really practicing acupuncture, I guess no harm in trying, because it doesn't just fit the physical form of your body or any form of ailment. It addresses at all levels the energy, your emotions as well. I personally practice this not only to adults, but
Yeah.
my son experienced this with me about when he is already 13 years old now, but when he
Wow.
experienced acupuncture with me, I tried first to him. He was about just only 7 or 8 years old, and he was really enjoying it because parang nga sa kanya that time, uso nun yung kung fu, yung
Diba?
si Panda, nakita niyang pinapuncture si Panda, napanood niya yung sa panang hingi. So, um, really enjoyed
Inspire.
having the feeling of being punctured, and it's just a matter of practicing it. But for the practitioners who's doing acupuncture, and for those that who want to try acupuncture, go to somebody who really trained to do that. There's a proper training of doing that. You have to study all the points that where you need to puncture, and all those points are all meridians that connected to all our organs in the body and emotional body. So there's so many benefits of acupuncture. So if you want to know more about this, you can inquire to our school, the Philippine Institute of Naturopathic Sciences. A while ago when Doc Mac was talking about acupuncture, we've been flashing all the contacts of this. So I hope you were able to screenshot or take a picture of that. Anyway, again, I'd like to say thank you very much to all our viewers right now. Thank you for continuously supporting us every Tuesday at 10 in the morning and every Sunday at 3 o'clock in the afternoon. We always give a teaser of what we are about to give every Tuesday. So again, thank you very much and have a blessed day. So, Pink?
Very much, everyone. Have a blessed day and have a nice week ahead to all of you. Bye.
Bye!